Welcome to On Your Block, a DPH podcast where we step into the community with the community to have real conversations about health, access, and the resources available to you right here at the St. Louis County Department of Public Health. I'm your host, Maya Clayton, and this space is all about breaking down barriers, sharing truth, and creating positive and honest narratives around what it means to live healthy and fully. Today's episode is a powerful one. We're talking about sexual health, specifically STI prevention, testing, and treatment, and what it looks like beyond the stigma. We're joined by a member of our STI program who's going to walk us through important tools like PrEP and PEP and the services available to you at the St. Louis County Department of Public Health. In addition to DPH staff, we will be joined by two community members who will tell us more about their journey and how they chose life while living in their truth. Whether you're here to learn, to feel seen, or take that next step for your health, you're in the right place. Welcome to On Your Block. I have a couple of cool people joining me today. Can y'all go ahead and introduce yourselves?
Okay, I'm Hezekiah Williams. I'm the project coordinator at Project Thrive and a life coach for the past 5 years.
My name is Zorian Price. I'm the Director of Prevention and Care for the Community Wellness Project.
And I am Justin Cole. I work over at St. Louis County as the Communicable Response Investigator or Disease Intervention Specialist. Ultimately, I'm here for the community.
Yes. Oh my God, y'all. Thank y'all for joining us today. This is our first episode. I'm so happy to have y'all here. All right. So let's get into it. We know when people hear STIs or hear HIV, you know, they have fear, right? They get scared because there's so much stigma behind it. What do y'all wish people actually understood about sexual health?
One of the main things that I always share with the clients that I work with and the patients that I work with is that sexual health is for everybody. It's your health. It's your holistic health. Ultimately, we want to see you thrive and be the best you that you can be.
I wish the community understood that it's normal. It's part of your everyday health, just as brushing your teeth, going to the dentist, going to the doctor for any other regular checkup. It's normal. It's part of our everyday lives.
All right, y'all. So, do a little icebreaker. Okay. Every episode of On Your Block, we're going to play a little game, and this one is called Myth or Truth, right? So I'm going to present y'all with 4 different common narratives or quotes that are said around the community, and we just going to kind of like talk through them, debunk them if they are myths. So, myth or truth? You can tell if someone has an STI just by looking at them. What do y'all think?
No pressure.
All right. 3, 2, 1. Myth. Okay, all right. Why? Why is that a myth?
Well, you can't tell if someone has an STD just by looking at them, no matter which one it is. A person could, for some things like syphilis have an outbreak, but for things as gonorrhea, chlamydia, HIV, trichomonas, all these things live inside of the bodies. Most of them have dormant periods, so you can be asymptomatic for extended periods of times and never show any physical symptoms at all. So you cannot just look at a person and tell they have a STD or STI.
And I want to piggyback off of you because I know that I particularly work with syphilis. And so when we see the primary stage where there could be a chancre or a sore, typically on the penile vaginal area, you can't see that walking down the street unless somebody's just walking with their pants down. So it's always important to just have that conversation, not only with your partners about, hey, when's the last time you've been tested, but talk to your doctors about, hey, I want to get tested, but more than just saying, I want to get tested. I want to get tested for syphilis, chlamydia, gonorrhea.
And I think that's important because like a lot of the community that I work with, you have people that know off bat, like, oh, when I see it, I know I can recognize syphilis easily. And I'm like, no, you cannot. Like, it's not that easy just to notice on somebody just by walking on the street. And then knowing that people is asymptomatic, a lot of the times people will carry that narrative like, well, I just don't get STIs. But you're just asymptomatic. That's it. But that's the routine testing that people need to know about and be important.
And I want to piggyback off one thing, like he did say, it's very important. Specify to your providers, to your healthcare, to your doctors, what you want to get tested for. Don't just say, oh, can you test me or I want to get tested. Be specific with them.
Y'all brought up this term asymptomatic. For the people who don't know, can y'all just like explain what that is? Is everyone asymptomatic? When does that happen?
So everyone's not asymptomatic, but when we say asymptomatic, that just means that you're not having symptoms. Okay. And so especially with syphilis, they call it the latent stage. And the latent stage means you're not showing, there's no outbreak, but at the same time, you still have syphilis. And that's why it's always important to go and get tested, just to know what's going on with you.
All right, cool.
Okay.
Thank y'all. So the next one says, myth or fact? PrEP is only for a certain group of people. So PrEP is only for a certain group of people. All right. 3, 2, 1. Oh, y'all all got the same answers. Okay, Hezekiah, why you say myth?
I say myth because if you're having sex, like, PrEP is for you. Like, it's to help you with your preventative. Now, we do get into the fact of if you're a person living with HIV or not, but that comes down to routine testing. Like, you can easily come into a place and get tested, learn your status, and then you can get started with PrEP in some places like that. So it's a myth to me.
No, I definitely can agree with you. We've seen the commercials for PrEP where they typically target a group of individuals, where they'll target men, they'll target the gay community as far as, hey, you all need to be on PrEP because you're more likely. That's not always true. PrEP is for everyone. And matter of fact, we have seen an increase in HIV cases in women, but also in African American women.
Like black women.
And
yes.
black women, yeah. So I know that the last time I looked at the data, we've seen where 13% or 14% of new HIV diagnoses are in women, but we know that in that percentage, 50% of those are African American females, right? And so PrEP is for everyone. I encourage, if you are sexually active, talk to your providers, talk to them about what PrEP looks like for them or for you. And again, that goes back to just advocating for yourself and advocating for your spouse too.
Yeah. With that point, I also read those same numbers that black women are actually leading the numbers in HIV. It's like that in the States, but also in Brazil as well. And that used to always throw me off because originally when I heard about HIV and when I thought of STIs, the narrative that was portrayed to me was it was only between men that had sex with men. So I think it's very important that we share that. Everyone should know their status. It doesn't matter if you're queer or heterosexual.
I've been HIV positive for 25 years now. And when I was diagnosed, you had to wait 2 weeks to receive your results, I believe. And even at that time, I believe when I first started medication, I was taking like 10 pills a day. And even over the time, like the HIV science and advancement in it have progressed so far. Like right now, myself personally, I just take 1 pill a day. There are plenty of treatment options for HIV. There are injections, which is every other month, and treatment that's every 6 months. So it is not a death sentence. Like I said, I have an 8-year-old son. I've been living with this for 25 years. I was a collegiate athlete in high school and college. Like I say, it has not affected my life in any negative aspects as I can see.
With that, I don't have any stats with that. What I will say is that when you are on your medication, that's the big thing that they say, U equals you. And that means undetected, untransmittable. We encourage people to be in care, be consistent with your care. And they'll see those numbers where you get into the viral lows start to dwindle to where you can't transmit it to your partner or to your to the individuals that you engage with.
But like, when he said U equals you, I really want to touch bases because a lot of people they don't know about it, even with saying it, like, oh, undetectable equals untransmittable. What's undetectable? What's untransmittable? Because people don't know that. Oh, we can.
Yes, what is it? Talk to me.
So, when we say virally suppressed, an individual who has taken their medication consistently for 6 months and get to undetectable, which means there are less than 20 units of the HIV virus per drops of blood. Did I say that right? Okay. Boom. So you are now undetectable, which means you cannot transfer the HIV virus as long as you stay adhering to your medication, staying on your medication, keeping up on your doctor's appointments, and staying virally suppressed. You cannot transmit the HIV virus once you have became undetectable. Now, you don't get undetectable and just, oh, I'm undetectable now. No, you have to stay on medication. You stay in treatment. These are the things we do to protect ourselves and also our partners as well. True. Because educating your partner on this, we can still have a healthy sexual life. Like I say, I have an 8-year-old son. His mother did not contract HIV. He did not contract HIV because I was undetectable during the time. And still, I've been actually undetectable my entire 26 years of being HIV positive. But like I said, I stay on my medication. I've always, it's just like, it's like one pill, or do I want to go down this rabbit hole, And
I think that's important because like now, as we have like the long-term survivors, people forget like after 10 years, you're considered a long-term survivor. But look how far medication have came.
Yes.
Like, it's 10 years from me now, but I remember when PrEP had just hit the streets and people were talking about it at the spot. They were talking about it here, but it was like PrEP, like people were still trying to navigate, is you gonna wear condoms? Like you still wearing condoms. So now we're hearing about PrEP. We like it's a pill to stop. So it gets those, your mind's going with what's the myth, because you hear people that for them long-term survivors was a small group. That wasn't a thing once upon a time. You didn't have people that live long term with this. So it was a death sentence for most groups that saw their friends dying weekly. So, and that's the last 10 years, so much has changed. Like we're now like having injectables, like people taking 1 pill a day. It's just so much advancement that we forget that it's happening in community that sometimes we have to catch it up with the stigmas that are available out in community.
Thank you for that. When y'all keep mentioning PrEP, right? So for the people who don't know who to ask the questions to, right? Where to go about asking those questions, come to the health department. Okay. Y'all also tune into this podcast. So can y'all kind of tell the people who don't know what is PrEP? And then I know there's also PEP. So what is PrEP? What is PEP? When do you use it?
So I'll pass it. So PrEP is pre-exposure prophylaxis. So it's basically the medication that you would take for a person who's not living with HIV to stop the contraction of HIV. So if you were to have unprotected sex, I know people say you only get it through anal sex. No, it's not. HIV is just not an anal sex. It's multiple ways that you can contract HIV, and PrEP is one of the treatment plans that you can take at some places for free to stop that exposure. And I'll let you explain PEP.
Yeah, so, and for me, the way I explain them both, like, you have PrEP, which for me, I explain like birth control. You take once a day, every day, like Hezekiah said, to stop from contracting HIV. It's 99.9%, efficient in stopping HIV contractions. PEP or MPEP, whichever one you may have heard, is post-exposure prophylactic, which I tell people is like the morning after pill. You can see your doctor within 72 hours of feeling like you had an encounter or was at risk of contracting HIV. They will start you on this pill if you did feel like you were exposed to HIV to counteract that.
And you got, 72 hours?
Yes, 72 hours to within feel like you was exposed to take that. So if you had a risky encounter on Friday night, you can just go see your doctor Monday morning. Boom, they could get you started on that. So anytime you see your provider, and like they say, you can go to the health department, you come to the Community Wellness Project. There are multiple organizations that can assist you with getting on either one of these medications.
Most definitely.
And PEP, okay, so you said that's like the plan B, right?
Yeah, that's the plan B.
Listen, I know a couple people 9 months later they couldn't afford that plan B, right? So now they got a surprise.
Now we have the gender reveal.
Exactly, right? So
No, sir.
is cost like a barrier? Is it affordable? Where can I go about buying it?
So I know, and I'm going to speak for the St. Louis County. With us, we have a PrEP coordinator who can help you with PrEP and with PEP. It is low cost because they will work with your insurance and also find resources for you. And we work closely with Washington University when it comes down to getting people access to PrEP and with PEP.
And the same here with the Community Wellness Project. We are the same way. We have PrEP navigators who will walk with you hand in hand to help you get that treatment. Much like the county health department, we work with multiple other organizations as far as getting you referred, getting treatment, getting you those discounts, getting the medication. We also have partnerships with these pharmaceutical companies where they also help provide direct discounts when the client is working with us or referring to us. So so definitely do not let cost ever be a barrier. There are ways around that.
So many things.
Yes.
Like even at Project Thrive, like if you don't have the insurance, we can get you started up literally the same day with our partnership with Southampton. which makes that so great because we have direct access to medical doctors. So if you was to even come in and you like, I want to get on PrEP, and you get a positive diagnosis for HIV, we can have you talk directly to a medical doctor to get you set up to see what that look like.
And that's only right up the street from y'all?
No, that's literally right upstairs. So we literally go up the steps and we can have the doctors come down. So that's the accessibility that we want to have for our community, because we 9 times out of 10 we know people of color, we don't have doctors that accessible and easily to reach. So that's a plus, because if you're trying to navigate like, okay, if I was dealing with diabetes, or now I'm dealing with this, is this going to affect my PrEP medication? Is me now having this new HIV diagnosis, what does my life look like? And we're able to help you understand all of that across the board while still getting you your treatment services of a one-stop shop. So any of these places that we mentioned, please, even if it's the call like, hey, I saw the podcast, I need more information about it, I'm kind of nervous. All of us are able to here to educate you and to debunk things. You can play the truth and myth game on the phone with me. We're going to set up an appointment.
Yes.
Because the main thing is, like you just mentioned, break the silence. It's like, don't suffer in silence. It's always, you got to break the silence. You're not going to drive down the street with 4 flat tires, okay? Pull over and call for some help.
I might have one because I want to get it home.
Listen, call AAA. This is your AAA team, okay?
I can imagine you just rolling down the street, ignoring the sound. That's crazy.
You don't even hear it.
But that's how people be sometimes, even when it comes to their own health. They may have like their discharge, or they may hear their commercial. They know they 5 bodies in, ain't seen no doctor, ain't did nothing. They like, well, ain't nobody called me and told me nothing, but you shouldn't have to wait on that. Just go on and get it checked out.
There's a lot of mistrust that comes with like medical doctors and with healthcare, and especially in minority communities. So how do y'all go about getting over that barrier?
So I want to say this first. I'm sorry. But so like,
Get it off your chest.
you can look at all of us up here. We're all from the communities that we serve. And that's what you will get at either organization you go to. I know when people hear health department, oh my God, it's the health department, they're scared. No. When you go everywhere, either one of these organizations you go to, everything is confidential. Your information is protected. You're working with the one individual from beginning to end that you started with. When you're handed off, it's with another medical professional. Your same intervention or navigation specialist is there with you. But when I walk to serve someone or help them, I help people that look like me. I come to you as a real person. I don't mind sharing my story or standing there hand in hand or walking hand in hand with you. And I know I've worked with all these other organizations, and it's the same thing across the board.
Truly.
To build trust, you have to be present. And you have to be willing to go in the fire with people. All right. And what I encourage the community is like, I know you're nervous about past healthcare, past experiences, but the reality is you still need care. You still are important. You still deserve health. You still deserve to know what's going on and be treated adequately. Right. And so I don't trust all car mechanics. I still need an oil change. All right. So in the same sense, your body is way more important than any car on this street. Okay. You are the Tesla. I'm gonna need you to come on out here and get taken care of and allow us to just do life with you. And know that there are people in place that genuinely care about you. All right. Call me. I'll make sure we get you situated and taken care of.
Like we say, I know about the Tuskegee experiment too.
Yeah.
They ain't getting us. I got you. I got you. Because that's the real thing, those old myths. And that's what kind of like made me think about people, where's people education level at? Not in a way to call out the ignorance of it, but to also show what's been put out as a whole to the community.
And that's why we meet them where they are, right? Because yes, we know about these experiments. And Google will tell you that you're dying tomorrow, but this is
Dr. Google.
But this is why we're here, so that we can do life with you, answer these questions. And if I don't know the answer, I have a coworker that knows the answer. I have a provider that knows the answer. I'm going to call one of you all because I know you all know the answer. We're going to get down to the bottom because we want the community to walk in facts, so that when they go forward, they can better take care of themselves.
You mentioned the Tuskegee experiment. I'm thinking Tuskegee. I'm thinking Henrietta Lacks. I'm thinking about the care that Black women experience during their birthing process, right? But that's why we stress representation is so important. Having people that, for some, it's having people that look like you. For others, it's having people that have similar experiences that you've had. And I kind of want to go back to, I know you were bringing it up earlier, just talking about y'all lived experiences, like how it's not only your passion for the work that you do, but also it's your experiences that you've had. So just at the time of diagnosis, like, can we just talk about that? Like, what was in your mind at that time? Did you have support?
How much time we got? So, my passion for doing this work, literally when I started doing this work, I started as a volunteer because I felt like I didn't have a meaning in life at the time. I truly did. And I felt like what I could do and give back was in this field, sharing my story to help my peers at the time, or other young black men, not have to go through what I went through. Like I say, at the time when I got diagnosis, I went to an agency at the time, which was a predominantly white agency. And at the time they did the HIV test. I went home, came back in 2 weeks. Guy walked into me, said, "You're HIV positive," handed me a folder, and he walked into the next room and told me just to call the 2 numbers at the bottom of the page. Now, at this time, I'm 16. Mother's died buses for Greyhound, so she's my parent. So there's no one at home. I'm the oldest of all my siblings, so I don't really have an older sibling to go to. I was also #1 wrestler in the state at the time. In high school, and my whole dream was just to go to college to wrestle. And so there were so many things going through my head, emotions, feelings. I didn't have anyone to talk to. I didn't know who I could talk to. I didn't know what to do. I was scared because my whole, like we all thought back, oh my God, it's a death sentence. I'm gonna die. But so what ended up happening for me, I think I lucked up. For me, I ended up getting a wonderful case manager. Her name at this time, I'm sure she won't mind me sharing, was Dana Bowen. And she walked with me hand in hand from beginning to end and reassured me. She called me on a regular. She showed up to all my appointments. She checked on me. She stayed on me. And I think that was my saving grace, because at that time, there wasn't, I believe there was one major all-black organization that worked, and that was the Harambe Center at the time.
Okay.
But even then, they didn't have specific like navigation or intervention specialists or people that walked with you and help you. It was just more of a drop-in center. Get condoms, get some education, get food if you want, but nothing as precise and entailed or detailed as what we do now. And once I did, I immediately got on treatment. Like I say, I was virally suppressed. My CD4 count was above 500. So I was living a really healthy life. My biggest worry, like I say, I wrestled. So I was constantly worried about bleeding on the mat. But I got educated by my doctor, which led me, I learned that, if just bleeding on a surface and someone touching it or being exposed to it does not transfer the HIV virus. As soon as your blood hits the air, the HIV virus actually starts dying. The virus cannot survive outside of the human body. That is a major, major part of educating individuals on HIV. Fast forward, I did deal with some shame, some stigma. I was very secluded. I was very private. I was younger. I was already going through puberty. Yeah. And so I was kind of struggling with puberty, and also coming out, and then trying to be sexually active. Like, there were so many things going through my head. And it really I ended up just really sitting back to myself, really educating myself. I actually I convinced my mother to allow me to be in a study, a HIV study through Washington University, which, because based off their science and what they knew, when I did get tested, I had been recently infected. So I did enter in that study, which was able to allow me to gain so much knowledge around HIV, about CD4, viral load, transmission, the treatment options, how the medication works, all of these different things. And I just really kept growing my knowledge of it. And like I say, I went to college, had no issues, wrestled all the way through college. And then eventually, even though I still kept this to myself and I was private about it, I really sat back one day and I asked myself, why was I so ashamed of it? People live with diabetes. People live with asthma, people live with sickle cell, people live with cancer, people have all these other, I don't want to say illnesses because I don't look at it like that, but have contracted, viruses or things that could potentially hinder or alter their health. And when I realized, like, I don't have anything to be ashamed of, and even when I did start disclosing my HIV status to individuals before we had sex, I never once got turned down for having HIV. And really, that made me really realize, like, a lot of stigma is internal.
Yeah.
We have a we fear what we think people may think without even giving society or people a chance. So I just made the decision one day that I'm just going to be open about it. If a person asks me about it, I'm HIV positive. I mean, there's nothing a stranger or another individual can do to hinder my life because I share this. I'm open about it. So there's no shame. It's never hindered me for employment, relationship, my personal life in any way. I'm not sure what people say behind my back, but I know I'm happy. I'm comfortable living in my truth. And I look at the people I've helped, the number of people I've had to tell that they were HIV positive, then I share with them. I've been HIV positive for 25 years. And not to be conceited, but I feel like I look pretty good. I feel like it was a saving grace. There are people without HIV that are, they are struggling. They doing bad. And today I'm here. Volunteered at the Community Wellness Project 10 years ago. Liked it. I liked the impact I had. I seen the change that it put in me, how I helped my community, and it started giving me back that sense of purpose. I wanted to like really give back, and like I didn't want anyone else to go through that experience. Like I never forget being handed that folder, and that was like out of not being told HIV, but the experience and the lack of empathy in it. That really is what traumatized me.
That was just so much, and I just like want to give you your flowers for just standing up and saying that, because it was a big thing for me to stand up, in the community that we in. That like when I was diagnosed in 2016, the community was already so shady. Like it was already so much mess going on. I was recently new into the scene. And like I was still a virgin at the time, so I'm seeing people be sexually active, people talking about condoms. We at the spot for Tuesday night crew, people trying to figure out who I am, and I'm just like, what is all of this? Like I'm learning about HIV, and then like I think a year will go on, like from 2015 to 2016, I end up contracting HIV from an ex who did never tell me their status from the whole get-go. Like I spent the little block. I can't admit that. I spent the block on them. We thought we was just gonna do a little link up, but something didn't feel right for me. So I ended up getting tested like 3 months later because I was adamant at getting tested at the spot. Like I was a myth believer. I was the one who my friends was very sexually active, and I was going to. And I'm gonna say her name because I know she wouldn't care. Nicole Carr at the spot. And I'd be like, Nicole, girl, I sat on my friend's toilet. They be out here. And she'd be like, Hezekiah, you cannot get no STI sitting off their toilet. I'm like, girl, they come see you almost every day. I'm like, I'm getting tested. And that got me comfortable because she worked with me. Like, she gave me that auntie vibe, like black auntie, like, okay, baby, you young, you don't know, but come on, let us give you what you need so you can get to knowing. So I got comfortable. So when I got hit with like, having just thoughts like I haven't got tested at them, what's going on? I got tested. It was I think it was like the Tuesday after Memorial Day or whatever, and went in the back. They set up the test. Lawrence did the test. It did all great. At this time I'm coming for any reason, just because. He ended up giving me the test results, and I looked at it and I was like, the 2 lines for y'all know the 2 lines on the test. I'm like, hold on, like, I'm the advocate for my friends. I'm telling them, like...
Wait, what the 2 lines for the people?
Oh, yeah, for the 2 lines, the test came back reactive. So sometimes we'll break it down where it's that 1 line, a control line that'll say it's for a negative test, but that 2 line on the test is like, it's a reactive, but what they tested for came back. Yeah. So when I saw that, I was like, it stopped me. Because I was like, I'm the one that's been advocating for my friends with positive and negative relationships, telling them that they... dumb, because why you gonna lose the love of your life because you don't want to put on a condom? Like it just didn't make sense to me. Like why stigmatize our own community that's already being oppressed? Like what is the narrative? And I grew up like in the field with my grandmother, of her doing this work, so I was used to some of the terminology, but wasn't as informed. Yeah. And so when I got diagnosed, it broke me. Like, I literally, that whole day, I cried in the back of the spot while everybody having TNC in the front. I'm just in the back crying. And I walked out after they cooled me, called Nicole. I just wanted Froyo and White Castles. Young, just needed something to satisfy me to actually what I needed. And I was sick. So you had to deal with, now you black, now you gay, now you living with HIV. You done did the worst of being the black gay thing. Like, you went out there and got HIV, and that's how it was. That's how it was in the community. Like, you had one thing not to do. And so being that superhero friend, I masked myself. I never told nobody. Like, I was quiet around my friends, but I was literally dying inside, like breaking down. I got on the medication. I was taking it on and off because I had a friend that got diagnosed a year before me, and they were struggling so bad mentally. And it would just hurt me to see them. So I would stop taking the medication. Nicole would call me and be like, what are you trying to do with your numbers? Like, what are you trying to do out here? And I had to tell her, like, hey, this was up. And that built my bond when it came to, like, my medical team. Like, she was like, okay, what do you need to know? I'm like, girl, what did Dr. Sabi say? You know, I'm pro-black. I grew up pro-black. So I'm like, what's the Dr. Sabi method? And she was like, okay, you can try being electric vegan. For y'all who tried to be electric vegan, baby, take that pill, because you going to be starving, skinny, tired, and still need to take that pill. What she said, we need man-made solutions for man-made problems. Like, I know you want to go the natural, healthy route, but let's use that for something else. So for 4 years, I was quiet about it. She eventually made me tell my mom, because I was distancing from my mom. Because you know how us people of color get, we be like, hey, how you? And you tell them, and then be like, what you up to? And then like, well, how everything been? By the time we got to the how everything been, I was gone. I wasn't staying at family functions that long because what was burning inside of me was hurting so bad that I couldn't sit around people no more. So I was losing my friends, I was losing my family, but I was still being there for my community. And it wasn't until I worked at an organization called Project Stop, and people was coming in telling me their status. And I was like, damn, how can I be genuinely doing this work? And they bold enough to tell me, but I'm sitting here ashamed. So Harold Lowry, rest in peace. He had asked me on the World's Day in 2019, by like the summer, he was like, Hezekiah, we need somebody young, newly diagnosed. Y'all, if you know how Harold was, he was like, we need this. And I was like, okay, I'm gonna find it. I swear I stepped, and it was like somebody stepped me in brown, and I told him. And he was like, you've been working here for a whole year and a half. You ain't never said nothing. He was like, we're going to put you on the front cover. We're going to make you give a speech. We're going to make you, because I had did so much at Project Stop to get the community involved that you wouldn't even think that I was going through or battling silent. Like when I say no friends, nobody to talk to, just my ex, who I thank him so much, that was dealing with me suffering, like getting in arguments, telling him that it was a pity that he was staying with me. I felt like he could have been with somebody else. And people were still trying to break up our relationship. And I'm like, baby, I'm already doing that because I'm so sad and mentally distressed because I didn't want to get help because I had to admit it. And so time went on. I told my friends. My friends felt bad because they was like, you suffered in silence with nobody to support you. And sometimes when we think about that, some of our hardest challenges, the people around us is able to help us carry it. They may not take the whole thing, but if I'm carrying 6 bags, it's a lot easier if you can pick up one. If I can pick up 4 now, or if you pick up another one, I got probably 3. But when I gave that speech and it had finally happened, I was like a world relief. Like it was like, it took everything off my body. I got an opportunity to be on a radio show and speak to 1.4 million people on the radio. That's actually how I came out about my status to my family, to people on Facebook. I literally was like, I'm gonna take this speech. I gagged everybody at the World's AIDS Day, and then I went live on the radio show. And after that, I was getting a pour in of people like, oh, I would have never knew. You don't look like somebody living with HIV. And it was the people in my DMs like, you so fine, you so courageous. Let me take you out to make you happy. And I was like, baby, hold on now. Like, but that's speaking to Zorian said, like, it's never stopped my life. Like, me and Nicole actually joked. She was like, I haven't seen nobody become HIV positive and their career take off. But I say that because it was me being genuine to myself. Like you said, you've been doing this for so long. It was the genuineness and the acceptance of self first that allowed me to be able to still speak out. Then be able to handle the one-on-ones. Because if it was a one-on-one, I just wasn't having sex. And once me and my ex broke up, I was like, we got to practice. So I used to be on the apps like, okay, you want to link up? What's your status? And now delete. Baby, I'm sorry. Yes, I'm the one that y'all was seeing. I'm deleting right after you say we about to link. I was scared. So after that, I just was like, everybody saw the Facebook post. So I was easy. Oh, yeah, I could tell you didn't know. But I never got, I got denied one time. And it was because a person was like, they thought, if we was to like kiss, they would get HIV. But that just lets me know they were older than me, and I'm like, kiss. And I'm like, baby, you but we gonna help you out. Let me help you out. Follow this link before you click on this picture. So it made me get out there more in community, but it made me realize how far back my community was with just even the acceptance, because I let it spread like wildfire with the rumors of, did you know Hezekiah, when y'all went on a date, did Hezekiah say this? Luckily, I was in a relationship, so couldn't nobody say I was doing anything. So that made me step out and want to speak more. And then ever since that campaign, I've just been making sure that my community is getting the resources. It made me become a life coach because I realized we can dig up our trauma, we can lay it out, but we also need to move. We also need to move forward. We got dreams and goals to accept and excel to. So this can still be an issue. But we still have to keep this life going. That's what I chose to do.
Absolutely.
Look, it is not on your partner to protect you. It is on yourself. People are going to say they've been tested. I'm good. I'm clean. No, if you wasn't there, if you didn't see it, you are the only one that can protect you. Like I was in love. Like my ex was cheating on me, boom, brought it back to me. And even at the time, I was so guilty. I really, I went and shared it with him. I came back HIV positive. He played it off for a whole week, act like he went and got tested and came back. And luckily, it was one of his family members who came to me and shared it because they, they felt so similar. And I was like, it really let me know like what people are capable of and what they will do. And that was just one of the things. Because I was writing stuff down. And like you say, back then when we got diagnosed, it was like you heard the people, oh, you sick, oh, you fat, oh, you gonna die. Nowadays, it's the opposite. You hear somebody talking about somebody with HIV or something like that, they're getting blacklisted, they're getting banned, they getting shot by the community, they getting talked about.
She getting chopped at the ball.
Yes. And if I'm up there, you better even get on a runway because I'm talking to you. Oh yeah. When I did share with my family, it was actually harder for me sharing it with my family than it was strangers. I had more ridicule and judgment from my family, my own mother, than I posed, like I say, my case manager who was there for me, or even the community. Like for like the first 2 years, I had to eat off like the same dishes.
Wow.
Like that she kept separate. Like, yes, my food was kept in a separate refrigerator because my medication had to be refrigerated too. So she bought a separate mini fridge, like all my stuff had to stay in. And at the time, I hated her. I was so like internally like confused because it's my mom, but it was her lack of knowledge. So what I did, one day I made her start going to my doctor's appointments with me. So she was forced to learn, and the case manager on the other side, like in her ear, letting her know, like, no, this is not that. And she did get educated. Thus, she was still like, don't tell nobody in the family though. Because that's always they don't tell nobody in the family. But like me, I'm like,
they might as well.
If they ask me, I'm not hiding nothing because this is my life and how I'm gonna live. And I made a decision a long time ago. I'm gonna live the way to make Zorian happy. I don't care what nobody else think. And like when I started living in my truth and sharing this, my career took off. Like I said, I've been doing this work. I've spoken on national stages, on podcasts, on news. Like when you live in your truth and you're actually giving back, people are gonna recognize that. People want people who aren't scared to stand up and say these things, destigmatize, like speak about the rights and like just what's wrong. Like Hezekiah said in the beginning, it is a mental, it's more of a mental struggle than it is physical struggle.
Truly.
It really, really is. HIV doesn't have very many physical effects. For me, I know personally what actually did make me go get tested, and I will speak to this, and this is one: never ignore your body. Never ignore your body. I don't care what signs you have. I was having night sweats. I was waking up like for a week straight, just drenched, just sweating. Like, and I didn't understand why. And that's what prompted me to go, because I did in my education here, like, that could be one of the signs or symptoms was night sweats, thrush. Once again, you can't tell by looking at anyone, so don't go say, "Oh, you sweat in your sleep, you got HIV."
Okay.
No, do not
You
do
got
that.
white stuff on your, you got white stuff on your tongue.
Yeah, oh, you got white. No.
No.
Those are just things that can be warning signs of that, but those can be warning signs of a ton of things. You maybe need to turn your air on. It don't matter. But I'm just saying, but I did not ignore my body, and it prompted me to go get tested, and not just about HIV, y'all, about anything. I was one of the ones. If I got a bump, what's up? Come look at this mug. I want to know, because I'm not gonna suffer in silence. There's too much medical advancement, technology, and medication and things out here to help us.
So what kind of things do y'all do or had y'all done to kind of get over that barrier? So like that acceptance piece, that healing piece. Like, it's easy to say, yeah, go heal. Or do that look like touching grass? Do that look like breathing?
I mean, for me, I had to really sit back and accept it. I really, I don't mean like, oh, what? No, like I really sat back and got into myself. Like, okay, what's going on? Okay, how is this gonna affect things? What does this really affect? How can you move on? Once I really accepted me, like, it isn't a death sentence. You're still healthy. Nothing physically about you has changed. I could still do my everyday life. When I accepted me, I wouldn't even say the world accepted me, because by that point I didn't care. So to me, I felt like, hell, everybody accept me. Ain't nobody saying nothing. Really, once I accepted it, it became an afterthought at that point. We battled internally, like Hezekiah say, and I never really said you suffer along. We suffer along because of the fear. We have a fear of not, what our peers are gonna say, or when we don't even give them a chance to console us, to help us, to give us that hand, to hug us, to like, look, I'm here with you, what you need. And you got to give yourself that grace, and you have to give your loved ones and the people around you that grace. And when I had came to that point, like, I was terrified of telling my uncle. He was a big time gangster, all this. He didn't even know I was gay. But it was so crazy. Like, I feared this man, and he is my best friend. He is my saving grace now. He's the one, like, I don't care that you gay. I don't mess with fairies, but I love you. But I'd be like, he was born in the 60s. But I get it. And I know that's his way of loving. He really is, like, he may not know what to say or the right way to say it, but he here.
And when you work with community, you realize that healing looks different for everybody. And so it's really important not to be the one trying to tell someone what it looks like for them to heal. Like, oh, you gotta breathe. You gonna cry. Like, some people won't, or some people will, right? And so it's like, if taking that walk helps you kind of embrace where you are, take that walk. If calling that loved one, having that conversation with the uncles, if that helps you heal, do what you have to do, but process. That's what I always tell people, process. In this life, we need to learn how to walk sometimes. Everybody wants to run. Everybody wants that quick solution. Everybody wants that, all right, let's slow down. All right, slow down.
Microwavable society.
Right.
Go on, preheat the oven.
Preheat
the oven. All of this has made me think about J. Cole, Love Yours. It ain't no such thing in the life that's better than yours. And I love that from whatever the experience was, whether y'all had support or didn't have the support, y'all took those experiences and channeled it into the way you guys choose to move and be in community. So not only are y'all saying reach out to community, but y'all saying we are the community. Reach out to us. We got y'all. If you could leave one message for the people in your community, right here on your block, what would that be?
I think mine is to love yourself harder. A lot of the times we don't give ourselves the grace to love ourselves, to be there for ourselves, to honor ourselves, because we seek, in this world, we seek so much outward validation. How many likes did my picture get? Should I post it on Instagram? Should I post it on Facebook first? Is this the outfit that's in season? But from this time, I've learned that the level of self-care you give yourself will be how you be able to deal with your problems. My uncle literally told me, you never want to keep a great balance in life. And I didn't understand that. He was like, because if life hits you hard, then the good goes down, then the balance, then the hard comes right back after. But if you do the extra stuff for your self-love, when that hard hits you, it may take you down a little bit, or it may take you back out to even, but it don't take you out your square. So love yourself harder. Do those extra things that you need to take care of yourself. That would be my message overall.
It's getting all about love, bell hooks. Like, love yourself.
No, seriously. It's hard because that's what I had to do. I literally woke up and I got in therapy, and my therapist was like, yes, because of your diagnosis. I was like, no, girl, because I was so sad I lost my man. But we can say it's that too. That is a freaking thing. But it made me start to love myself. She asked me those questions. What brings you joy? What brings you happiness? And I had nothing. When I thought of joy, it was just, Anita Baker, you bring me joy. And she said, well, play the song every day and see what inspires after that.
Yeah.
But that was something I loved myself. And I was learning to learn more parts of myself. And I was forcing it every day, beating the mental stigmas, beating the self-doubt of my hurt and my pain. That I was like, Hezekiah, so I got in that mirror and pointed like, I love you. I know you don't feel it. And I know this is some crazy stuff that they telling you to do. Do it. I was getting up, trying new stuff I never tried before, learning stuff I didn't like because I needed to get comfortable with this body. As my godmother says, you take you with you everywhere. So love yourself when you show up in these spaces.
So surface level, my basic answer, I would say educate yourselves. Get educated on this. Viscerally, internally, I really want people to take away, like Hezekiah just said, like you only get one, you only get one life. You only get one body, you only get one you. Take care of you. Don't care what nobody else think about you. If you look in the mirror every day and you're happy, that's all that matters.
Well, I'm sitting here as a, what would they call me? Cisgendered male, married, married with children, and I'm recognizing in my community, you deserve healing. You deserve to come out and know your status. All right. It is not something where it's like, oh, I don't need that just because I only mess. No. Know your status for yourself. All right. And it doesn't take much to love people. Right. I got into the sexual health realm on a project that wasn't designed for me, but because I said, hey, I love black men and I believe all black men deserve healing, I stayed on the project. And that led to me working at St. Louis County down the line. And so I'm here now to say, hey, you deserve healing. You deserve health. Come get it. All right. Don't keep your mouth closed. We're here for you. And even if you want to keep your mouth closed, I'm going to sit with you until we can get to the bottom of it, even if you need somebody to sit with. This is what we're here for. So, yeah.
Come on, y'all.
Definitely, thank y'all.
I have a great friend, and she says that you were the pilot of your own health. So with that being said, listen to the information that Justin, Zorian, and Hezekiah have given y'all today. And thank y'all for joining us.
Thank you
for having us.
We on your blog. We
Block.
on your blog. Thank you for tuning in to On Your Block, a DPH podcast. And to our guests, thank you for not only sharing your knowledge, but your truth. Conversations like this remind us that health isn't just clinical, it's personal, it's emotional, and it's deeply connected to our community. If you take anything from today's episode, let it be that you deserve access, you deserve care, and you deserve to live fully and freely. Be sure to stay connected with the St. Louis County Department of Public Health to learn more about STI testing, prevention options like PrEP and PEP, and the many services available to support you. And if today's On Your Block message resonated with you, don't keep it to yourself. Share this episode with someone in your life because that's how we shift narratives and build healthier communities. I'm your host, Maya Clayton, MPH, and this has been On Your Block.